Hello and welcome to this unit, which is Unit 35, supporting individuals at the end of life stages. So we know that in health and social care, eventually we will all pass on and die. And part of end of life is ensuring that we have a good death. But to have a good death takes a lot of planning and resources. Hopefully you will have watched the video on end of life care and you could become an end of life champion. And it's a complex and quite sensitive subject. We still know that people don't like talking about end of life or preparing for end of life. And yet it's one of the more fundamental important things we can do in health and social care. We all have a responsibility to manage it in a sensitive manner and be respectful towards people. We need to respect their wishes that they make. So let's look at what this unit will require you to do. So first of all, you need to understand current legislation around degrees ways of working. So we know we have the Mental Capacity Act. We know that people are entitled to make decisions, but they must have the capacity to do so. We're aware that we have the Care Act 2014. We have the Equality Act, and we have other legislation there to protect us. So it's important that we understand our policies and our procedures. We may have advocates or courts of orders, or alternatively, our next of kin and loved ones can work for us. What's important is that we make advanced decisions. And advanced decisions need to be made during a time when we are well. It's important that we're not coerced or forced into making decisions later would not stand up to a test in court. So it's important that we protect people's rights. So how does the legislation protect people during the end of life stages? Well, under the Mental Capacity Act and under the mental health, it's important that we can demonstrate people have capacity. And if they lack capacity, people are making decisions on their behalf in their best interest. So let's look at factors affecting end of life care. So it wants us to explain theories around emotional and psychological processes that involve the key people that may experience the approaches to death. We know there's Bulbus's theory to attachment. We know there's theories around Maslow's hierarchy of needs. But we know that there's theories around death that involve grief and loss. It's important for us to understand that some people aren't able to discuss them, maybe because of religious beliefs or because of upbringings or just their fear around death. However, we need to try and work with them for them to understand and be able to make informed choices around decisions. Equally, there's now concerns around being a donor, as now everyone has opted in. So it's important that people understand that if they do not want to be a donor, that they need to opt out. And again, there are certain protective characteristics around those. 2.2 wants us to understand religious beliefs and cultures. So it's important that we work in a personal-centred way when working towards the end stages. We need a good understanding of equality and diversity. Certain religions will have certain rituals or beliefs that need to be carried out for stages. Therefore, it's important that we're aware of those. Catholics may want last rites, and Muslims will want to be buried within a 24-hour period. So it's important we've had those decisions and advanced decisions already made, and we know people's rights and choices. Some people may not want to be resuscitated, and some people will want to be resuscitated. But again, it's important that we have those discussions early on. 2.3 is about explaining how individuals' well-beings can be enhanced by the end-of-life care. So the environmental factors are important. Remember, as we go through the dying stages, we may lose the ability to communicate, therefore non-verbal cues. When we're unwell, we may feel the cold a little bit. So it's important that we're able to look at the environment and make sure it's appropriate for the person. Let's think about the environment. Music, calming, warmth, lighting. They may not be able to move, so therefore, if they're in their home and the light's coming around, will the light be on their face during periods of the day and they're not able to move away from it? Non-medical interventions may be things that they've chosen to happen to them. It may be things for pain relief. It may be certain things that they've asked to be done for cleansing of the body. We should be aware of the equipment and aids. So, do they have a syringe drive for pain relief? We know how to use the syringe drive if you're trained to do so. Alternative therapies as well may be useful towards the dying stages. It gives people comfort and hope. So again, are you aware of those and are you able to use any of those? 2.4 wants you to discuss why support for an individual's health and well-being may not always relate to their terminal condition. The reality is sometimes people don't want to be treated as a own person, they want to be treated as a whole. And no one wants to be treated as a disease or an illness. They want to be seen as the person that they were. Therefore, it's important we take into account people's holistic needs and well-being, and we don't just focus in one particular area. Overall, if we balance people's needs in a holistic way and work in person-centered, we should be able to meet all the needs of an individual. Therefore, it's important to have discussions with people on the way in which they want to be treated. Remember, people are allowed to make unwise choices towards the dying stage, and even in the dying stage. We may not agree with them, but it's their choices to make if they have capacity. We need to understand any advanced decisions in care in relation to the end of life. So, first of all, it's helpful to explain the benefits to an individual of having control over their areas of life. Making decisions whilst you're unwell seems a relatively straightforward thing to do. However, it can be quite difficult because it invokes those feelings of loss and sadness and can be quite difficult for people to come to terms with. However, the benefits of people having control of their life means they'll be treated in the way that they want to be treated towards the dying stages. They'll be able to understand interventions and they'll be able to pick and choose what they want to happen to them. So fundamentally, it's fundamentally important for those that may have religious or cultural needs to ensure that those needs are being met. 3.2 looks at the advantages of care for planning. You should be able to explain the purpose of a living will or advanced decisions. It gives people comfort knowing that their decisions will be upheld and respected. On our website, we do have an end-of-life section. It's important that you read those and understand the processes for end-of-life care. We work through what's called the gold standards framework, enabling people to plan their death and ensure that they're able to receive the care and respect that they want. They're able to explain when they want their food and fluids to be stopped, when medication or treatment to be stopped. They're able to make decisions about whether or not they want to be resuscitated or the extended life treatment. The problem is, it's very difficult. People will state that they're not making decisions and they're making emotional-based decisions. Therefore, it's important that all decisions are witnessed and to be ensured that people aren't being coerced or forced into decisions. So you need to evaluate your own role in supporting and recording decisions for care. This is going to be one of those things for you as a carer that will provoke many different feelings. Depending on your own values and your own beliefs, you may see some of the decisions people are making as maybe assisted suicide. The reality is people have the right to choose how they want to be treated. Remember, it's our job to be non-judgmental and to keep our values and our beliefs to one side to ensure that we're respecting other people. Think about how difficult this could come. There will clearly be ethical and legal issues that are raised around advanced decisions. For example, Whilst you're well, you may say that you don't want treatment, but towards the dying stages, you may become scared or you may change your mind. Therefore, the advanced decision will become nil and void, and your current wishes will be adhered to. But it's important to recognise the fact that actually these decisions are there to support people, to help them realise and make informed choices. As without that upfront knowledge, people aren't able to make informed decisions. Other ethical or legal issues might be if somebody wants to not be resuscitated, but the family wants them to be resuscitated. That can be quite difficult, explaining to a family member that actually your relative's chosen not to be resuscitated, but they want it. However, all of these things need to be talked about early on, as when the dying stages arise, it's not then appropriate to have those decisions. And therefore, it's important for people to understand their decisions may not always be upheld. Learning Outcome 4 is about providing support to individuals and key people during the end-of-life care. You should support the individual and key people to explore their thoughts and feelings around death and dying, and work within an agreed way of working. Therefore, it's important we look at our communication skills. Are we providing a safe space? Are you giving information in an impartial way? Are you providing it to them in a way where they're able to pick and choose? Are you being mindful that you're not giving your own opinions and your own judgments? 4.2 is about providing support to the individual and key people in a way that respects their beliefs, religions, and cultures in line with agreed ways of working. The reality is you might find it difficult holding those conversations with certain people, especially if it's outside your area of expertise or maybe a religion or a practice you're not familiar with. Never be worried to talk to your manager or other people around things that you've seen or heard. It's important that you understand decisions that people are making, so therefore you're more confident and comfortable with decisions. It's about you being impartial, and that's a really difficult thing because, as I've said, we all hold our own judgments. 4.3 is about demonstrating ways to help individuals feel respected and valued throughout the end-of-life period. It's important we review their care plan and treat people as they want to be treated their whole entire life, maintaining dignity, talking to them, and showing them the kindness, love, and respect they deserve. It's important that when we're working with the individual, that we communicate with them and we're respectful. If the patient or the customer is unable to talk or communicate, it's important that we carry on communicating with them. So moving on, we should be able to provide information to key people about individuals' illnesses and support them. So again, it's useful if you're not aware of somebody's illness that you talk to specialists. We know that there's other companies out there, such as Macmillan Nurses or agencies, that are able to provide lots of information around maybe cancer or terminal illnesses. But it's useful for you to have an understanding around them. Equally, I've done an end-of-life care video that explains the stages in the last year, months, days, and hours. So it's useful for you to know what happens to the body. Recent research suggests the more we know, the less frightening it is. So it's useful for us to be prepared. 4.5 is about contributing to the partnership working. And therefore, it's important we talk to everybody and we work in a collaborative way, because the reality is we have many holistic needs. We have pain and discomfort, we have nutrition and hydration, we have our own medical needs, our own emotional needs. And therefore, it can take a range of experts to ensure that people aren't in pain or discomfort during the dying stages. 5.1 wants to explain the importance of recording significant conversations during the end of life. It's important we keep accurate records for many reasons. 1, for scrutiny, 2, for transparency, And 3, in case family members want to ask certain questions. It's useful for us to have recorded conversations because it helps us with an audit trail for advanced decisions or decision making. 5.2 looks at factors that influence or should give significant news to an individual key people. When we're giving news around end of life, we're saying that we don't think somebody is going to live for much longer, it's important we do this in a respectful and dignified way. We need to understand and always remember that we're working with people and that we find the right space and time to have those conversations. It's important that we provide the right environment, ensuring that we're not disturbed, and that we're able to use a pace and tone and a sincere body language which shows the fact that we're working in a dignified and respectful manner. We need to give advice or news in a way in which we allow the person that's receiving it time to understand what we've said and make them feel supported in the decisions in which they need to make. It's important to realise that your environment should have things such as water and just to give people an opportunity to compose themselves and be able to talk. Afterwards, they may want to be able to talk to somebody about their feelings and how they're going to manage those. 5.3 wants you to explain conflicts and legal and ethical issues that may arise during the relation to death, dying, or the end of life care. Through my experience, it's normally family conflict that ends up causing the problems towards the end of life stages. People wanting different outcomes to the patient, family members having arguments, or people coming out the woodwork that somebody's never seen for a long time. This causes family distress and causes family rifts and arguments. It's important for you to maintain a calm environment, especially in the room that care is being given. Therefore, it's important to talk to people beforehand, have some idea about how the family dynamics and any of the conflicts that are potential could possibly arise. And it's about setting some of those ground rules. It's important that we don't have arguing or family fallouts in the room. And therefore, we can take people to one side and talk about the appropriateness and finding them a space or a room to have those, especially if other people around them are unwell. So having some kind of action plan is always a good way of dealing with things. It's important that you have as much information as you can to manage any of the conflicts. That might be coming around of handling information, who to report things to, who to inform, and all of those things will make it easier for you when managing the final stages. Then outcome 6 is about understanding symptoms that might be identified at the end of life care. So identifying symptoms that may lead related to an individual condition or pre-existing condition and or treatment itself. So having an idea around the end of life processes is really important. We know that during the end of life stages, we stop eating, we find it harder to breathe and harder to communicate. There may be health conditions there that are already causing underlying problems. Especially people with COPD, chest infections, are probably more prone to pneumonia. So the more we're aware around underlying conditions, the more we can put interventions and nursing strategies into place. 6.2 is about understanding some of these and ways of reducing stress and discomfort. Therefore, if we know somebody's having breathing difficulties, we could put them onto some oxygen to help alleviate that. Maybe if somebody's in severe pain or discomfort due to maybe treatment, we can have a syringe drive administering morphines or oral morphines or end-of-life medication. 6.3 looks at the signs of approaching death. We know in the last few days we stop eating, we become gaunt and withdrawn. Breathing becomes shallow. Skin starts to look a little bit more dried out. There starts to become a grey sheen over the body. They may become incontinent or doubly incontinent. You may hear breathing or some kind of gurgling noise. It's important to recognise some of these signs, as therefore it gives family an opportunity to respond and come and say their goodbyes. Again, we cover those in the end of life video online during our in our section for end of life. 6.4 is about different techniques for alleviating symptoms. Again, there's lots of things that we could do. Maybe repositioning somebody, moving them up or lying them down in bed. It's about looking at different techniques around maybe medication, or if we're stopping medication, rather than supporting people to eat and drink, they move on to just the end-shore drinks, 40 sips, or build-up drinks. There's different techniques there available, and again, these should be discussed with the nursing team or doctors. Number 7 looks at understanding the roles of organisations to support services available to individuals and key people in relation to end-of-life care. 7.1 wants you to explain the role of support for organisations and services that contribute to end-of-life care. Again, the gold standards framework suggests that we should be preparing these and providing resources up front. There are many charities and organisations out there that can help. Things such as benefits or financial burdens regarding that. Sometimes the governments will do things like crisis loans to cover the cost of a funeral. There's other organisations out there to help with bereavement and loss. It's worthwhile talking to your churches or community groups to find out the types of things that you can offer other people or at least recommend. 7.2 wants you to explain the roles and the value of advocacy in relation to end-of-life care. The value in an advocate is to ensure that we have transparency and that people are being offered the best possible care in their dying stages. A lot of the elderly people tend not to want to bother people. They feel that they're a burden already. And it's important that they don't feel this. It's important that they feel they have a voice, even if they're not able to discuss it. We want to ensure that everybody has a good death, meaning we should have people that are able to make decisions for people once they're unable to do this. 7.3 explains how to establish this and when advocates will be beneficial. It's used for them to be appointed at the earliest point possible. Therefore, they're able to understand the person or the service user beforehand. They're able to look at the decisions that are being made and able to weigh up what the best are. You'll be able to find advocacies online through different services. And again, hospitals generally have different people there to perform that role. Also, looking around the mental capacity and advanced decisions as well. Number 8 is about being able to take actions following the death of an individual. 8.1 wants you to explain the importance of recognising and supporting individuals with wishes after care. It's important in sometimes you may not touch the body until the coroner or somebody or the police have come out, depending whether they've been seen by a doctor within the last 14 days. Somebody will need to verify the death and record it to be able to have the paperwork to carry on. Because of religious and cultural beliefs, it's important that you're aware of what to do with the aftercare of a person. As in, not following that could delay the body being and the paperwork being processed and the wishes being followed through. 8.2 wants you to carry out actions immediately following the death that respects the individual's wishes to follow agreed ways of working. It's important we secure the room. We may change the sheets and the beds to white sheets. You may be asked to carry out the last offerings, which is wash and change the person and prepare them for the family to see the person. It's important that you understand the agreed ways of working. If the death needs to be verified, it's important that this is done first. 8.3 is about to demonstrate the support given to key people immediately following an individual's death. So again, it's important to pass on your condolences and your sympathy. It shows that you're human and that you're aware of their loss. Asking somebody what you can do to help them could be an appropriate way forward. But again, death can be quite a complex and trying time to be. So ensuring that you're aware of who the coroners are, who the undertakers are, and just to be able to explain the processes really helps somebody during a time of need. My advice is always make sure that you're aware of all of those processes beforehand, as after the person has died, it can be quite stressing. 8.4 is to discuss national guidelines and local policies relating to care after death. It's really important that you understand the processes. Normally, a verification of death takes place. That could be done by looking at the loss of life, signs of no respiratory system, cardiac system. This might be done by a registered nurse or a doctor. The death is then recorded and verified. That creates paperwork for the undertaker or the coroner, depending whether or not the person was seen in the last 14 days by a doctor, or if the death was known, or if it was suspicious. If it's not suspicious, the body is normally taken to the undertakers and it's prepared in line with the agreed ways. If there's any cause of suspicion, the coroner will probably want to inspect the person and make their own conclusions. Therefore, that could delay the aftercare. Number 9 is being able to manage your own feelings in relation to an individual's or it's important that you can explain ways of managing your own feelings in relation to an individual death. We're aware that dealing with death can cause strong emotions. It can make you feeling sad and low, or some people see it as a celebration of life and the last thing that you can do to support somebody. However, it's really important that you're able to talk to people about your feelings about managing death. We'll all deal with it in our own unique way. It's important that you're aware of your support network around you. And again, that can be through supervision or just through peer support. 9.2 is using the support systems to manage your feelings in relation to that. And again, that could be through your supervision. So let's quickly review this. Learning outcome 1 was looking at current legislations. So we have the equality, human rights, mental capacity, NICE guidelines, health and safety goals, and safeguarding. Agreed ways of working look around confidentiality, sharing of information, infection, personal care, end-of-life care, the rights to a good death. We've already spoken about that. Understand their viewpoints and advance decisions. There are some theories and models there for you to have a look at around stages of grief. Beliefs in religions, looking at kind of different family needs and supports there. Looking at environmental factors and non-medical interventions. Use of equipment around washing, dressing, and pressure relief, and alternative medicines around aromatherapy, massaging, and reflexology. Outcome 3 is about understanding advanced care planning in relation to the end-of-life care. So that's the benefits of having as much control as possible, about alleviating fear and empowering people. Advanced care planning is all about ensuring that they're going to get the treatment they want, and again, it's a voluntary process. Ensuring that you have clear records and sharing information with your care teams, and making sure that people are aware and right to refuse treatment and care is reported properly. Ethical decisions and legal issues are around advanced care planning, refuse to treatment. There may be legal issues, withdrawal or withholding treatment, and we need to make sure about assessing capacity and who has the lasting power of attorneys. Then outcome 4 is about being able to provide support to individuals and key people during their end of life. Respecting cultures, respecting values, providing information, and partnership working. Then outcome 5 is about understanding how to address sensitive issues in relation to end of life care. So having those conversations, making sure that you're sharing the information, making sure that care is up to date, the care plans are up to date, that you'll know and that you're aware of key ways of working. Then outcome 6 is about understanding how symptoms might be identified in the end-of-life care. So looking at pre-existing conditions such as dementia, confusion, cardiovascular disease, breathlessness and pain, and ways of dealing with distress and discomfort. We talked about signs of approaching death, so change in conscious level, awareness, pain, breathing, and the colour. Outcome 7 was about understanding the roles of organisations supporting services available to individuals and people in relation to mental health care. Other organisations could be palliative, hospice, home care, domiciliary, care homes, respite, day services, and funeral directors. The role and the values of the advocate is that they give you the independence. It's a voice reasoning and, again, a way of just providing that additional support. Number 9 is about managing your own feelings in relation to the death. Again, your own feelings of grief, loss, and grieving, and the support system that you should have around your own mentors and teams and bereavement. You'll see here in your suggested reading, you've got 3 or 4 books to have a look at and some websites for you to review. And again, it's always useful to have access to those websites because when you talk to family members, you're able to pass those on and provide further information to people. For you to complete this unit, you'll need to download the workbook and fill that in. I wish you all the best of luck, and I will see you in your next unit.